Now, somebody asked a question. Me as a YouTuber, when I'm in class, I'm actually paying attention to very important questions that my mates will ask the staff. Of course, if my mates will ask the staff questions, somebody around the world is also having a question mark about this. Now, we say that if you want to examine women patients, especially, you need somebody to be there. All right. Now, they call that person a privy. They call that person a chaperone. Do you understand? So you're now trying to say, why do you actually need an eyewitness to be there? Why must I actually bring somebody to be there when I'm examining a patient, a woman patient? So having a chaperone during the examination of female patients, especially during intimate and sensitive procedures, all right, procedures I have to examine them, examine the reproductive system, touch the breast for breast examination. It's a critical practice. Now, I'll tell you reasons why. First, you are protecting the patient. The patient knows that you are there for business and not for something else. Alright? So it ensures the patient's safety, ensures that the patient is respected, ensures that the patient is supported. So most of the time, the chaperone could be a family member of the patient, or if it is not a family member of the patient, if it's somebody in the hospital, should be a nurse or another doctor, and that doctor should be same sex with the patient. So talking about female patients now, this one is her husband. That one, it's kind of like interchange. I just brought the image, all right, but just take it like the man is the doctor, the woman is the patient. Of course, the other nurse is serving as same sex with the woman. Do you understand? So that's just how you do it. So it helps the patient prevent feeling of vulnerability or embarrassment. So often reassures that there is, professionalism right here. So it protects the clinicians. So eyewitness will be there in case there's any misunderstandings coming up later, because there's a whole lot of law cases flying up in obstetrics and gynecology. In fact, I will even specialize there because, bro, those law cases are really, really flying. Do you understand? So it reinforces professional boundaries and behavior. I check you in the hospital, I see you at a club, I don't know you. Do you understand? Yeah, I know you, but just greet and pass, bro. That was strictly business. Do you understand? So promotes transparency and trust. Okay, so demonstrate a commitment to ethical practice. Ethical practice means there are some laws that have been established before you even got into the medical school. This is one of the laws. It shows that you are following the laws, right? So legal and institutional requirements. So many hospital and medical boards mandate chaperones for intimate examinations. So documentation of chaperone presence may be required in some medical records. Right? They will ask you who was there. Okay, so you don't have to be caught like I didn't actually, So who can be a chaperone? A trained healthcare professional could be nurse, assistant, or those chills. Okay, should be the same gender as the patient. So female should be female. All right, must understand their role, observe, support, and intervene if necessary. If not a healthcare professional, the spouse could actually come around. Okay, so that's it for why you actually need an eyewitness when examining female patients, not women patients. It could even be a small girl,